Have you ever wondered how breast cancer treatment has evolved over the centuries? Breast cancer, a disease that has posed a significant health challenge for centuries, has seen remarkable strides in understanding and treatment. It's been a journey of exploration, of trial and error, and of relentless pursuit of knowledge. The evolution of breast cancer treatment is not just a medical history lesson. It is a testament to human resilience and the unyielding spirit of scientific discovery. From the dawn of medicine, when the diagnosis was often a death sentence, to the modern era where survival rates continue to rise, the path to understanding and treating breast cancer has been fraught with challenges and victories alike. This journey is one of hope and courage, a journey that has transformed the way we perceive this once terrifying condition. As we delve into this topic, we'll traverse time from the earliest recorded attempts at treating breast cancer, through the advent of surgical interventions, to the dawn of radiation and chemotherapy. We'll explore the leaps and bounds made in the field of genetics and immunotherapy, and how these advancements are reshaping the landscape of breast cancer treatment today. Why is it important to understand this progression? Because it provides context. It sheds light on how far we've come and how far we have yet to go. It helps us appreciate the sheer tenacity of the human spirit and the tireless efforts of countless medical professionals, researchers, and patients who have contributed to this ongoing fight against breast cancer. In this video, we'll take you on a journey through time, exploring the evolution of breast cancer treatment. From ancient medical practices, steeped in superstition and mysticism, to today's world of personalized medicine and targeted therapies, we'll uncover the fascinating history of this complex disease and the extraordinary progress that's been made in combating it. So, fasten your seatbelts and prepare for a journey that promises to be as enlightening as it is inspiring. Let's dive into the fascinating world of ancient medical practices. Imagine living in a time where disease was often attributed to supernatural forces. Picture this. You are in a world where the understanding of illnesses, especially something as intricate as breast cancer, is shrouded in mystery and superstition. The word cancer itself was a moniker of dread, a whisper of an insidious force that could strike without warning. In the realm of breast cancer treatment, the ancient world was a tapestry of trial and error, of hope and despair. Around the world, different cultures had their unique interpretations and strategies. The ancient Egyptians, for instance, believed in the healing power of spells and incantations, alongside the application of herbal poultices. Similarly, the Greeks and Romans resorted to an array of herbs in an attempt to treat the disease. But let's not forget the rudimentary surgical procedures of the time. The idea of surgery might seem horrifying given the lack of anesthesia and sterilization, but it bore testimony to the human spirit's relentless pursuit of healing. Surgeons, armed with primitive tools and a rudimentary understanding of the human body, tried their best to remove tumors, often leading to mixed results. It's essential to remember that these practices were born out of a time when the understanding of the human body and disease was minimal. The concept of cells, let alone cancer cells, was non-existent. The cause of cancer was a riddle wrapped in an enigma, often attributed to imbalance of bodily fluids, punishment from the gods, or even the alignment of the stars. Yet these trials and errors were not in vain. They were the stepping stones to our present understanding of this complex disease. The herbs used by our ancestors laid the foundation for many modern medicines. The rudimentary surgeries evolved into the precise, life-saving procedures we have today. Fast forward to the 19th century, and we begin to see a shift in the approach. The advent of modern medicine began to peel back the layers of mystery surrounding breast cancer, ushering in a new era of understanding and treatment, but that's a story for the next scene. The 19th century heralded a new era in medicine. This was a time of great change and innovation, an age that saw the birth of modern surgical techniques that would forever alter the course of medical history. In the early part of the 19th century, the concept of surgery was a daunting one. Without the knowledge and tools we possess today, surgery was often a last resort, a desperate attempt to save lives in dire circumstances. But as the century progressed, a revolution was underway. The discovery of anesthesia in the mid-1800s was a pivotal moment, providing a means to manage pain and enabling more complex surgical procedures. Among these was the radical mastectomy, a surgical procedure developed by William Halsted in the late 19th century. Halsted, a pioneer in his field, fundamentally changed the approach to breast cancer treatment. This procedure involved the removal of not only the breast tissue, but also the surrounding lymph nodes and chest muscles. It was a drastic method, but for the first time, it offered a real chance of survival. The advent of these surgical techniques brought significant improvements. Survival rates increased, and for many, a diagnosis of breast cancer was no longer an immediate death sentence. Yet it's crucial to acknowledge the harsh realities of these early procedures. The radical mastectomy was a physically and emotionally taxing operation, leaving many women with significant physical disfigurement and psychological trauma. The dawn of modern medicine was certainly a time of hope and progress, but it also highlighted the pressing need for more refined, less invasive treatment methods. It was a period of learning, of trial and error, of victories and setbacks, but each step, each breakthrough, each challenge overcome was a step closer to where we stand today. As we moved into the 20th century, further advancements were on the horizon. The seeds of innovation planted in the 19th century would grow, pushing boundaries, challenging conventions, and paving the way for the future of breast cancer treatment. The 20th century was a time of rapid scientific advancement. In this era, the medical realm was no exception, with significant breakthroughs and innovations in the fight against breast cancer. Let's dive into the development of radiation therapy first. This treatment method uses high-energy particles to destroy cancer cells. It was first introduced in the early 20th century, with dramatic improvements over time. Now, radiation therapy is an integral part of breast cancer treatment, often used after surgery to eliminate any remaining cancer cells. Next, let's talk about chemotherapy. This method uses drugs to target and kill rapidly dividing cancer cells. First used in the mid-20th century, chemotherapy has evolved since its inception. Now, it is administered in various ways and tailored depending on the type and stage of cancer. It has become a powerful weapon in the arsenal against breast cancer. Another significant development was hormone therapy. This treatment method was developed after the realization that some breast cancers are hormone sensitive. They grow faster in response to certain hormones. So, hormone therapy was designed to block these hormones, effectively slowing or stopping the growth of these cancers. In the late 20th century, researchers discovered the link between genetics and breast cancer. This groundbreaking realization led to the identification of specific genes, like BRCA1 and BRCA2, associated with an increased risk of breast cancer. This discovery has revolutionized the way we approach prevention and treatment, allowing for more personalized care. Lastly, the 20th century brought a shift towards less invasive surgical procedures. Instead of radical mastectomies, surgeons began opting for breast-conserving surgeries. These procedures aim to remove the least amount of breast tissue necessary, preserving as much of the breast as possible. This shift has improved the quality of life for many breast cancer survivors. Now, let's see how these historical breakthroughs have paved the way for current treatments. These advancements have not only increased survival rates, but also drastically improved the lives of those living with this disease. Today, we stand on the shoulders of giants, benefiting from centuries of medical evolution. The landscape of breast cancer treatment has been transformed by leaps and bounds, largely due to the advent of personalized medicine. This modern approach tailors treatment to each individual, considering their unique genetic makeup, lifestyle, and the specific characteristics of their cancer. In this new age of medicine, one size does not fit all. Instead, we see an emphasis on targeted therapies designed to attack specific types of cancer cells, leaving healthy cells unharmed. These treatments work by interfering with certain proteins that help cancer cells grow and spread, offering a more precise and less damaging approach than traditional chemotherapy. Alongside targeted therapies, we have also witnessed the rise of immunotherapy. This innovative treatment harnesses the power of the body's own immune system to fight cancer. By boosting the immune response or teaching the immune cells to attack cancer cells, these treatments offer an exciting new avenue in the battle against breast cancer. These advancements have not only improved survival rates, but they have also enhanced the quality of life for patients undergoing treatment. Today, more women are surviving breast cancer than ever before. The 5-year relative survival rate for women with stage 0 or stage 1 breast cancer is nearly 100%. And even in advanced stages, survival rates have improved significantly. But it's not just about survival. It's about thriving. Personalized medicine aims to minimize side effects and maximize effectiveness, allowing patients to maintain their quality of life during and after treatment. It's about empowering individuals in their fight against cancer, providing hope where once there was fear. But what does the future hold for breast cancer treatment? The future of breast cancer treatment is a beacon of hope and a testament to human resilience and ingenuity. As we stand on the threshold of a new era, we can't help but marvel at the promise and potential that lie ahead. One of the most exciting advancements on the horizon is gene editing. This revolutionary approach aims to modify specific genes within our DNA, potentially allowing us to prevent or even cure breast cancer at its very source. Imagine a world where we don't just treat the disease but eliminate it from our genetic code altogether. And then there's the role of artificial intelligence in diagnosis. With machine learning, we can sift through mountains of data and identify patterns that the human eye might miss. This could lead to earlier detection and consequently more effective treatment. It's like having a super-powered assistant tirelessly working round the clock to help us outsmart this disease. But perhaps the most tantalizing prospect of all is the potential for a vaccine. While it may sound like science fiction, researchers are already exploring this possibility. A vaccine could train our immune system to recognize and destroy cancer cells before they have a chance to spread, effectively turning our body into our own best defense. These advancements are not just idle dreams. They're the fruits of tireless research and relentless innovation. Yet, they also underscore the importance of continued exploration. The more we understand about breast cancer, the better equipped we are to fight it. In this pursuit of knowledge, we also find a deeper appreciation for the journey that has brought us here. Each breakthrough, each innovation, each stride forward is built on the hard work and dedication of countless individuals who dared to dream and never gave up. While we look forward with optimism, it's crucial to remember the journey that brought us here. The future of breast cancer treatment is bright, but it's the past that illuminates our path forward, reminding us that every step we take is a step closer to a world free from breast cancer. As we've seen, the evolution of breast cancer treatment is a narrative of progress and hope. It's a tale that we've woven from the threads of human endeavor, scientific curiosity, and an unwavering commitment to improving lives. We started our journey in the distant past, where the mysteries of breast cancer were met with fear and uncertainty. From the crude and painful methods of the olden days, we've since navigated a path of trial and error, ultimately giving birth to the dawn of modern medicine. We've traced the footsteps of pioneers who brought about breakthroughs and innovations, transforming the landscape of breast cancer treatment forever. They've gifted us with tools that have not only improved survival rates, but have also significantly enhanced the quality of life of those affected. From surgery to radiation, chemotherapy to hormone therapy, our toolkit has expanded, becoming increasingly precise and personalized. Personalized medicine has opened up a world of hope, where treatments are tailored to the genetic makeup of the patient and the unique characteristics of their cancer. This approach promises to maximize efficacy while minimizing side effects, offering a beacon of light to those navigating the murky waters of a breast cancer diagnosis. And yet, our journey is far from over. With the promise and potential of future advancements, we stand on the brink of a new frontier. Each day, researchers around the globe are pushing boundaries, exploring innovative approaches, and unlocking new possibilities. From immunotherapies to gene editing, the horizon of breast cancer treatment continues to expand. As we reflect on our journey, let's not forget the importance of continued awareness, research, and advocacy. It's through these efforts that we can ensure progress doesn't falter and hope doesn't dim. It's through these efforts that we can empower every individual affected by breast cancer, offering them not just a lifeline, but a promise of a brighter tomorrow. The story of breast cancer treatment is ultimately a testament to our collective determination to overcome adversity and improve lives. Here's to the ongoing journey.